So I'm Pauline Whelan. I lead the digital health software team at the Centre for Health Informatics at the University of Manchester, and I'm the co-director of the GM Digital Research Unit at Greater Manchester Mental Health. And I'm going to co-present this. We're going to do a double act with myself and Simon Foster. And Simon's a senior creative web designer with the digital health software team. So we're going to talk about the PPIE app, which is a project that was initially developed as part of the NIHR Greater Manchester Applied Research Collaboration. And it's kind of taken on a new life with the Clinical Research Network giving us some additional funds to take it forward to develop some equality, diversity and inclusion work, working with the GM Digital Research Unit at Greater Manchester Mental Health. Just before I start, and to ensure I don't forget, I want to say a big thank you to the CAMS Digital Young People's Research Advisory Group. They've been a great help throughout this project. It's a group of about 60 young people interested in digital mental health, and they've really helped us to steer the development of this project. So thanks to them. So I'm going to give a little bit of background to the rationale behind the PPIE app. Simon's going to give a very quick demo of the mobile app that young people can use to contribute their thoughts to mental health research. He's also going to give a very quick demo of the researcher interface that mental health researchers can use. Then we'll talk about the relevance to data science and trying to reach seldom heard, underserved communities. And we'll end then talking about the benefits, hopefully, of a digital PPIE platform. So following on really from the last talk, we know that patient and public involvement and engagement has traditionally been a face-to-face activity, albeit through COVID times. I know lots of people have jumped to online activities. But we know that for participants, face-to-face activities, attending focus groups or workshops can be really difficult. And this might be because of the travel to a particular site, for example, or taking the time to join a half-day workshop, or maybe people don't like contributing to groups. And we know also that researchers sometimes have difficulties recruiting participants, finding participants, and that there's particular groups that are often seldom heard in PPIE activities. And we also know some of the common problems that are reported in PPIE, like contributors not receiving feedback or updates on the projects that they've been involved with, or not feeling like they're really being able to shape the nature of the research being planned. And for PPIE teams, sometimes there's a lack of knowledge around what works in PPIE. So we were looking for new ways to enable people to contribute to research, and we were particularly focused in the first phase of this work on research into young people's mental health. So we wondered if a digital platform could help. We envisaged that providing people access to contribute to research through an app, a mobile app on your phone, where they could contribute short bits of feedback from anywhere in the world, respond to polls or short questionnaires, help shape the research, and get regular project updates from the research teams as the project developed, might be a way that people would like to contribute. And we also saw benefits for researchers being able to reach people more easily, have an easy way to feedback to participants, and so on. One caveat to this, though, we're not trying to replace face-to-face PPIE activities or other digital PPIE initiatives. It's just one other way we thought might help. And I suppose I shouldn't go any further without recognizing digital exclusion, and that we know digital apps are not going to work for everybody. So it's really trying to use this as an additional, supplemental way to do some PPI activity, not trying to replace all the other fantastic methods that are out there already. So what have we done so far? Well, as a digital health software team, we've been doing a lot of user research, so asking people about their needs and preferences for the app. We've run 6 co-design workshops with young people, with mental health researchers, with PPIE leads. We've run a Moscow prioritization system, so it's a very simple agile methodology to classify the requirements into must-have, should-have, could-haves, and won't-haves, so that we could know what to develop in the platform. And we've now developed the first version of the app. It's available on Android and iOS, or will be very soon, just as we complete beta testing in the autumn. So before I go any further, I'm going to pass over to Simon to give you a quick demo of the app.
Thanks, Pauline. Hi, everyone. I'm going to quickly demonstrate 2 aspects of our PPIE app. One is the researcher interface, which will be accessed via a web browser, and the second is the participant interface, which will be accessed via a mobile app. So starting with the researcher interface, the researcher would first of all log in, and they're presented with a list of their current PPIE projects. We'll return back to this page, but firstly we're going to create a new project, and we're going to do that by adding a title. And then we're going to build an audience or specify an audience. So in this case, we're going to create an audience for 19 to 49-year-olds with an interest in anxiety and depression. And then finally, we're going to add some more details to our project, including a subtitle, the dates that we want feedback to and from. And then we can add some more details in the form of text and possibly video too. Finally, we're going to add some payment details. And then the last thing we can add is a question, so that anybody who shows an interest in our project, we can ask a question directly to them. Once we've done that, we can publish that, and that will be added to our list of current projects. I can then click through to view a project, and here we can see at the top the details of that project, the date, the audience, and the category. A little bit further down, we can see the feedback that project's received. So in this case, overwhelmingly positive feedback. And then we can see the user engagement over time. Additionally, a researcher can ask questions ongoing throughout the course of the PPIE project, and we can view those by clicking on the questions tab. Here we can view the poll results as well as any anonymous responses. If I want to ask a new question, I can do so. In this case, we're going to add a very quick poll, and as soon as we create that, that will be added to the users or the participants' mobile app so that they can respond to that. And the final thing a researcher can do is provide updates. So if we have any news to share on a particular project, any progress, we can do so, and that will be shared with all the participants. So that more or less covers how a researcher can add and manage their projects. From a participant point of view, they would start by installing the app, and part of the setup process that they have to follow is adding their year of birth and choosing their interests. And once they've agreed to the privacy, they'll then be matched with any of those projects that match their age and interests. This is the homepage that everyone will see after they've finished that initial setup. And we present each project as a card. You can see there's a stack of 3 cards here. And we're very simply asked, first of all, do we want to hear more? In this case, you want to say, yeah. We can watch a video, read some copy about the project. We can decide we do want to contribute. At that point, we are asked that question that the researcher added. We can provide some feedback, and then we're asked whether we want to remain in touch for future opportunities and future contributions, and we can say yes, we are. That card then disappears from our stack, and we can go to projects to see all the different projects that we are involved in, and by clicking on them, we can view that timeline updates that the researcher has added, as well as view and respond to any questions or polls that the researcher may have asked. So that's a really quick whistle-stop tour of our PPIE app. I'll hand back over to you, Pauline.
Thanks, Simon. So the next phase of the project that we're just starting on October 1st this year is to capture age, ethnicity, and gender metrics from people who are happy and consent to share these data with the app. So we hope that this will enable us to visualize and report the metrics, to help us identify who's using the app, who's not using the app, and who's not being represented by PPIE activities. And we hope also that by capturing metrics across many different projects, we'll be able to build up a picture of what works in digital PPIE. For example, if we can see that a particular project has done really well at reaching particular seldom heard groups, then there may be lessons that we can share with other research teams. So building easy to interpret reports into the system to support this shared learning is really important for us. And we want to co-design the app further with underserved groups. We'll be running lots of co-design sessions to try and co-develop the platform. Just to mention that this also sits alongside a parallel program of work run by Professor Dawn Edge, and she's looking to develop online and in-person training to increase clinical study officers' capability to recruit participants from underrepresented populations into clinical studies. So hopefully that work could sit alongside the researcher interface that we're building and add to it. So what we're hoping is that the PPIE app and platform will deliver a learning health system, bringing data science to help us develop best practices around digital PPIE and really to maximize the benefits of using a digital platform. We also hope that the analytics from the system might help us understand exactly who is and who isn't being heard in PPIE. We're hoping also that it might produce evidence for decision-making about which approaches might work best. So for example, a test bed for do videos work better than images, or does jargon-free text work better? And so as we capture the analytics about which projects are doing well to recruit from seldom heard groups, we hope it will help us all learn about what works. And we're also planning to link it up to other digital PPIE initiatives so that we get a seamless experience for public contributors. So Simon's going to show a quick demonstration of the future dashboard now.
Thanks, Pauline. So this is a very early prototype of our dashboard that covers all the various bits of data that we will be able to display in relation to the PPIE app. So first of all, we have an overview of all the live projects currently on the system, the number of active researchers, the number of active users. We can then break down those users by demographic, in this case age, by their user engagement, and then also look at the interests and see how many users we have aligned to each interest, how many projects we have aligned to each interest, and also whether any of those interests are trending, to see whether there's any interesting insights we can gain there. If we want to dig a little bit deeper, we could go into reports which are split between users and projects. And here we can see the entire user base and how they're split over age, gender and ethnicity, as well as user engagement and again, those interests. Should we wish to, we can filter that. So we can look at 16 to 20-year-olds of all genders who are Asian or Asian British with an interest in depression. We then choose those dates that we wish to run that test from and click apply, and we can see that those have been updated. One interesting takeaway here is that we can see as we're filtering by depression that the highest number of this interest table is depression. But we can also see that there are other high numbers such as anxiety and eating problems. That's because users can have more than one interest. So that, again, there's more insights that can be gained possibly from looking at that data. We can also look at the projects, and again, very similar data. And then further down, we have the individual projects themselves, including the title, the name of the researcher, the number of contributors for that project, and the feedback that it's received. We can then filter that by an interest, for example, anxiety, with a minimum and maximum number of participants. And we can see we've reduced that down to 7 projects, and we can view those 7 projects. And then if we want to drill down even further, we can click on a project and view that data specifically related to that project. That goes right through to user engagement and even down to the questions that we asked in the app, and then breaking down each of those responses into those age, gender and ethnicity categories. So that's a very quick whistle-stop tour of how we might approach displaying the PPIE app data.
Thanks, Simon. So just one last slide from me. So we're at the very start of this new project. In fact, it hasn't even started yet. So what you're seeing in terms of the dashboard that Simon's just presented are sneak previews. And we've got to do a lot of co-development and co-design with stakeholders to really shape it into what it needs to be. But a starting point is to try and understand who is seldom heard in digital PPIE and highlight and visualize that within the platform. So we're hoping to extend our co-design workshops over the coming months. So that's the end of the presentation. We do have one favor to ask of people. If you're happy to contribute to a short activity to help choose the name and logo for the app, we'd really appreciate it. Simon will post the link in the chat. And if people are happy to contribute, that would be fantastic. And if you're not, that's also fine. Thanks very much.
Thank you very much, Pauline and Simon. Terrific. we've got a minute or two. We've got some questions already. One from Hayley Lowther, whether participants can ask questions of the researchers as part of this, so it's bidirectional.
Yeah, that's a really nice idea, and it's something that has come up in our co-development workshops as well. I should say that the first phase of the app has been built on a very small budget, really on a shoestring. So it's in our list of requirements, and it's something that we hope to build as and when we can afford to do it. We'd really like to.
And then a question from Sarah, Fantastic App. Do you have some sort of quality check that the research projects are legitimate, or do you have a kind of way of only letting in vetted people in some way?
Yeah, exactly. And there's something we're working on as well. But at the moment, it's just NIHR projects that have been funded. And we also have an ethical review board for projects to go onto the app. So it's kind of a two-stage process there.
Okay. And one thing I was keen to find out is whether do you have links to, for example, NHS services, so that you know from your starting group of patients what proportion are making it onto the app, for example, because you said that you could look at demographics within people that use it, but can you compare that to who you should be getting if it was unbiased?
Yeah, exactly. That's something that we want to link up with. I mean, that's the next phase of the research, to understand exactly how we will develop the dashboard and how we will compare the representativeness across what it should be geographically against prevalence of different disorders and so on. So that's something that we're definitely looking into, but we haven't developed that phase yet. That will be in the next phase.
Okay, and then a couple of other questions. Whether you're collecting data on sexual orientation and residential location, presumably you can sort of add what you want here, can you?
Yeah, exactly. The first phase is just age, gender, ethnicity. And as soon as we've got those, we'll hopefully expand it out.
Thank you.